So dental implants are great at restoring your smile, especially when you have missing teeth. Implants can restore those gaps. They can get your function back. It can restore the aesthetics, and it can also give you a natural feeling with your restorations, and you treat them just like your natural teeth.
Implants are used for to fill gaps. That's the simple answer. Imagine something like this, and then we have a gap here. So the implant is composed by three steps, three components. One is what we call the implant. The implant is the screw here, and then this is the abutment, and then on top of the abutment we have the crown on implants. We have three options for to replacing a gap. One option is the denture, and the other option would be a bridge. A bridge, we need to shave down the teeth like this, and then in this situation we do a bridge. Okay. In this case we have the one big block of material that it's a bit more complex to clean. The other option would be doing the implant. Imagine that you have the two teeth here. We place the implant here, and then after 3 months we can place the abutment and then the crown. So this is how we do the implant.
So implants are great, almost the best alternative for people with dentures, with missing teeth in the back, with a very strong drive to get their function back. It's a great option. With dentures, it's a very affordable product, but it's not great. It needs a lot of adjustments, it needs redoing all the time, and it's very uncomfortable in the mouth.
Implants, in my view, are the best solution because I don't need to touch the other teeth. We fix just the problem of the gap, that is the gap.
When you first come in for a possible implant, the first thing we do is to do a 3D scan with x-rays and also with our 3D camera to actually come up with a surgical guide that's going to help us to place the implant accurately. We do all the designs on the computer. We have the implants placed with pinpoint accuracy. After we manufacture the surgical guide, we book you in for our surgery session where we place the implant. Afterwards, we make sure you're okay. We give you all the instructions on how to look after your newly placed implant, and then you go home and rest. And we wait for 3 months after the implant is placed until the bone and the implant has fully integrated. Once it's integrated, we can manufacture the crown for you, and it's just a couple of visits then, very quick, a few days apart, and your tooth is back. Sometimes we can deliver a provisional crown in the same day. Sometimes when I'm doing teeth in the front, I like to, if the implant has a good grip in the bone, I can do the crown the same day. And then we wait 3 to 6 months to install the definite crown. Many people come in with the concern that the implant's sounding a bit scary, sounding a bit painful. Pain is something that everybody's concerned about. And with the implant, I'm just doing a perforation in the bone, and the perforation takes 3 seconds. It's like this, you know? And then I use 2 different burrs. Usually it's 2, and then we install the implant. What I hear all the time is as well, "Oh, are you done?" It's a dentistry in general. It's more about dealing with the anxiety of the patient, because the technical part is, you know, usually pretty smooth. Sometimes the next day, the very next day, the patient tells us that there's almost no pain anymore. There's absolutely no bleeding, and it feels normal, and they don't even have to take any painkillers. It is done in a very sterile environment. We do everything by the book. There's really nothing to worry about in terms of the surgery. You're in very, very safe hands here. After the crown's manufactured and placed, then you pretty much look after it just like any normal tooth that you've got in the mouth. You brush, you floss, you use your antibacterial mouthwash every now and then to help you to keep the area clean, and you come back to us and we'll keep an eye on it for you as well. So in ARTSMILES, we have the latest tech. We have everything you can think of to actually get the implant placed with pinpoint accuracy properly and make sure it lasts a long time. We design everything from scratch. The material that we use as well is of the highest quality. We don't really compromise on that at all. When you do an implant in ARTSMILES, you know it's going to work, you know it's going to stay, and you know it's going to be strong.